Okay, so what is Klinefelter syndrome is, as or everybody knows here, is I think this is 47XXY and is the most common disorder of the sex chromosomes in human. And the frequency is 500 to 700 males, and it's 1,000 in general population. And when we consider the infertile man, we can see it in 3% and 14% in azoospermic man, which is 80% of the men is non-mosaic and 20% of these are mosaic form. As you see here, not every Klinefelter's patients is the same. You see the Ryan here, he is publicly known, and he is a Klinefelter's man, but here is the clinical characteristics, and most of them you don't see him on him. But the prominent, the essentials of this syndrome is atrophic testis, which is 2 to 3 milliliters, and increased FSH and LH levels. And we can see normal and decreased testosterone levels in the various in non-mosaic Klinefelter's patients. How about the spermatogenesis? When we look at these patients, majority of them are azoospermic. And in mosaic form, we generally see in severe oligozoospermia, but some of them may have present with azoospermia. And very rare cases in the literature shown that the paternity with natural pregnancy. And men with non-mosaic Klinefelters who had severe oligozoospermia, progressive decline in and spermatogenesis, and resulted with the azoospermia during their life. So when we look at the literature, it has been shown that increased frequencies of hyperploidy in the sperm of Klinefelter's men compared to control group. And then the studies suggest that only 47XY germ cells enter the meiosis. Scriano and associates, the authors, show that fish analyzes all the Klinefelter's patients. All spermatogonia have 47XY cells, but Sertoli cells shows 47XXY. A very new study, it's done recently and published recently. They look at the Klinefelter's men and prepubertal boys, and they check the testicular tissue. And post-pubertal men, all spermatogonia have 47XY. However, the tubules present spermatogonia. The Sertoli cells also contains the normal karyotype. The tubules which doesn't contain any spermatogonia, all the Sertoli cells showed 47XXY. When they look at the prepubertal boy, again, in the tubules, spermatogonias contains 47XY. However, regardless the presence of the spermatogonia, all Sertoli cells contain 47XXY. And they checked also prepubertal and postpubertal samples, peritubular myoid cells and Leydig cells. They may have 47XY and also 46XY and 47XXY. So it's mosaicism. So there's evidence that Sertoli cells after puberty lost their 1X chromosome, which also helps the tubules produce sperm from spermatogonia. However, we don't know yet when the spermatogonia loses their 1X chromosome, and now we are doing research, and we got the grant, and we will continue this research with associates. And when we look at the evolutionary testicular sperm retraction from the non-obstructive azoospermic man, it has been shown first with Tournaya and et al. In 1996. First, there's a sperm recovery from the tese, and the first live birth rate is using this testicular sperm was shown Palermo in 1998 with the success of live birth. And when we look at the large series, including our series, we show different sperm retrieval rates from the 35% to 66%, depending on the clinics, the different clinics. And the newest one from the China, 284 men, they showed that around 45% of sperm retrieval success. One study showed meta-analysis about the sperm recovery outcomes, a systemic review from Italian group, Corona et al. They showed that they look at 139 studies and 37 were included in this study. It's more than 1,248 patients with Klinefelter syndrome, and they are operated with microtese in 18 studies and conventional tese in 13, and 4 of them is the mixed technique they used. They checked the sperm recovery rate comparing the surgical procedure, and they find that surgical procedure does not affect the sperm retrieval rates, which is 44%, and success rate, bilateral and unilateral information were similar in this study. However, I would like to show you one video, if it works. I hope it will. And you decide. Sorry. Excuse me. What happened? What happens in the... Sorry. Would like to show this video for you to decide which procedure is better compared to microtest. Now I'm showing the assistant. First, when we open the testis, I actually see where the sperm production is. But we open the testis, and I would like to ask assistant where the sperm production is, and he showed that this area is probably sperm production is. I go to the higher magnification, and clearly we see that this area with the tubules, very small area, and we dissect these tubules and we find the sperm very small area. As you see the tubules here, maybe it's clear with the vision. Very, very small pieces we got, millimetric pieces, what we got. Without the magnification, it's impossible to see this kind of very small areas. As you see here, there is another enlarged tubule, and we're going to go to low magnification, and we see all the area, which is impossible to see without magnification. And there is another sample here, as you see, is an enlarged tubule, another Klinefelter's man, which enables us to find correct area without giving a chunk of tissue to embryologists, so embryologists loves us. Very, very small and clean tubules that they can find the sperm, and we can get the success from the ICSI. Okay, we will show you the dishes so you can see how small is the tissues. Is there very millimetric. Okay, so in this meta-analysis, they also showed that age, testis volume, and hormone parameters for FSH, LH, and total testosterone did not predict the sperm retrieval. However, we know that from a single clinics from 2005, they showed that aging is affecting on sperm recovery, and also a couple of months later, in our study, we showed that younger age than 35 is high success rate compared to older age. And also the Schlegel's group showed that aging is important in these single studies. Another recent study from the Cornell University, they look at their data 1995 to 2020, 217 patients with Klinefelter's patients, and in this group 59 adolescents, including the adults, 158 adults. They are between 20 to 29 years, 62 patients, and 30 to 39 years of age, 88 patients. And they have a very few numbers after 40 years of age. And they look at the sperm retrieval rates. And they find that adolescents lower success rate compared to 20 to 29 years of age, very high success rate. But it's similar when you look at the 30 to 39 years of age, the success rate is similar to adolescents. And after 40 years, there's a very low sperm retrieval rate. And they check the histology, and germ cells are getting reduced when they check with the aging, and men over 40, there is no germ cells they noted in the biopsy. And when I see this paper, I would like to look at our data between 2004 to 2020, 2004 to 2022. We collect 231 patients retrospectively we evaluated, and we compare the hormone levels, testis volume, and age of the group of men, which is 45 men, 20 to 29 years, and 30 to 39 years, 154 men. And after 40 years, we have 34 men of Klinefelters. And when we look at the sperm retrieval rates, in young age, we have more than 60% of sperm retrieval, which is in 30 to 39, decreasing to 45%. And after 40, it's around 30%, and which is significantly lower. And we check the clinical characteristics. Of course, sperm positive group has a younger age, and we saw that left testicular volume is lower in the sperm negative group compared to sperm positive group. That was an interesting finding for me. And I also checked the literature, and we found that from Turkey, another study from 2021, they also see the left testis volume is significantly higher in positive group. And another study, 2023, they found that in 118 men with Klinefelter syndrome, left testicular volume is significantly higher in positive group. Also, this is an interesting finding in Klinefelter's men. In the literature, they also check for the hormonal manipulation and optimization. Is it work with the sperm retrieval rate? This study showed that using HCG, aromatase inhibitors, and selective estrogen receptor modulators to improve the surgical success. And they used initial testosterone below 300 milligram per deciliter in the patients. And data showed that responders to medical therapy have higher success rate compared to non-responders. However, a new study, again, from GUA, Fertility and Sterility 2020, they check 184 men with Klinefelters, and they give them HCG treatment before microtese. The groups are divided in two groups, treated and untreated. And treated group was 134 patients who received HCG every 2 days for 3 months, and they didn't give anything to 50 patients. And when they checked the success rate, treatment group is 43% versus non-treatment group is 44%, and they didn't see any significant difference in this group. So, as an expert opinion, Dr. Schlegel's mentioned that the efforts to increasing the endogenous testosterone by using any medical treatment is not influence the outcomes as much as intraoperative experience of the surgeon or with the quality of the andrology and embryology team, as Dr. Kolpe mentioned before. When we check the ICSI results and look at the meta-analysis, the fertility after the ICSI evaluated in the corona group with the 39 trials, and ICSI procedure was performed with the cryo and or fresh sperm, and they find that total 218 biochemical pregnancy after 410 cycles, which is 43%, and 211 live birth, with the live birth rate is 43%. And they stated that using cryo or fresh sperm showed no difference, pregnancy rate and live birth rates. When we look at the single clinic series, in the large series, they showed that in Cornell, which is the pregnancy rate is 53% and live birth rate is 45%. In our group, we saw the same results as the Cornell, which is the pregnancy rate is 53 and live birth rate is 47. From the Europe, they find that the pregnancy rate is 39% and live birth rate is 21%, which is low to compare to other groups. And the statement from these low results is maybe the different selection of the patients or using conventional TESE technique in European study and legally limitation of the number of the embryos to transfer and using the freeze-thaw sperm with the ICSI may lower the ICSI results. So the conclusion, men with the Klinefelters can have a child by TESE, micro-TESE and ICSI. The sperm recovery rate may change with the age. The average success rate is 30 to 55%. And the meta-analysis, however, did not show any predictive value clinical parameters such as hormone levels, FSH, LH, total testosterone, and testicular volume, and also the age of the patients. To clarify the effect on success, sperm retrieval, optimization of the testosterone or other medical treatments before the micro-TESE needs more randomized trials and studies. And when we look at the literature, very few chromosomal abnormalities was detected on the babies. However, the guidelines still suggesting the PGD and genital concealing in men with the Klinefelter's patients. Thank you for your attention.